Hello, everyone. Hope you can see the slides.
Yes.
Um, yeah, as was said, my name is Ekaterina Milyanova, and my colleague's name is Artem Volgin. We are from the K&A team. A couple of words about our background. We work as consultants at the World Bank, and we are a research assistant at the International Laboratory for Applied Network Research in Moscow. I'm going to present our work, which was called Policy Interventions and Voluntary Actions for Battling Coronavirus Pandemic, Multi-Level Vector Out-Regression Modeling using the CMU and UMD survey data. So as it follows from the title, in this work, we wanted to see how policy measures and people's behavior are associated with the coronavirus pandemic, the spread of coronavirus, and what practical insights can be actually gained from such analysis. In brief, our problem for this research was that there have been quite a bit of studies that try to evaluate the effectiveness of non-pharmaceutical interventions to combat coronavirus. However, there was a scarcity of research that accounted for people's behavior in such analysis and that used survey data in their research. So we wanted to sort of fill this gap, and at least at the exploratory and hypothesis-generated level, we wanted to demonstrate the possibilities of leveraging the CMU and UMD data in the analysis of the relationships between policy interventions and voluntary actions for mitigating coronavirus pandemic. We are going to present our results separately for the US and for the rest of the countries that were present in the data. So as for the US, we used an array of variables. They are listed on the slide. The most important ones are the following. Community COVID-like illness, or CLI, which is the percentage of respondents who know people with coronavirus symptoms in the community. Then our main behavior-related characteristics, avoiding contact, which is a percentage of respondents who said that they were trying to avoid contact for all of the time and most of the time. And we also used additional data in our research called Stringency index. That variable was created by colleagues from Oxford, and it reflects the rigidity of lockdown-style measures that restrict people's behavior. And we also use some official statistics in our analysis. Right, so methodologically, we used a method called multi-level vector out-regression modeling. It's a method that allows you to build models where all your variables are assumed to be causes and effects simultaneously. So it accounts for this problem of simultaneity in the data, and it also treats properly the problem of heterogeneity due to the multi-level structure. So in general, that method allows to compute networks of contemporaneous between subject and temporal effects. In our research, we focused mostly on the temporal effects and used 14-day lag. So that choice I'm going to clarify further. Right, so first we wanted to see for exploratory purposes how coronavirus symptoms are associated with the new cases. We build a network of temporal effects. So here you can see that only two symptoms, anosmia, ejose, and fever, actually increase the new cases confirmed, which is logical because that can be the symptoms that distinguish coronavirus from flu. And also from such networks, you can trace the sequence of the symptoms, of the coronavirus symptoms. Then we build our main models using all of our variables that we were interested in, and we used two measures to register the spread of coronavirus. So we used community CLI variable that were present in our data and official statistics and new cases confirmed. And so we built two separate models, and as you can see from these networks, the structure of the relationships is very similar, meaning that community CLI actually quite accurately captures the new cases variable. So further, we're going to use that variable in our analysis. Here we quickly justify the lag selection in our work. So we use the 14-day lag. Why? So you can see that within the first roughly 5 days, community CLI is mostly affected by itself, while over time the effects of other variables start to become more pronounced, and roughly around the 14th day, the magnitude of all associations looks relatively stable, so we use that in our research. Then we split our analysis by age groups. That was a possibility. So as you can see from these graphs, for all the age groups, stringency index and avoiding contact variable do not significantly affect community CLI variable, while for younger people they do. which is an interesting difference that we observed while analyzing different age groups. Also, since we used random effects in our model, we can visualize those effects by states and highlight whether a state experienced later peak or early peak. Here we show the effect of avoiding contact on community sea lice. So as you can see from this graph, those states that experience later peak have actually the coefficient which is higher in absolute terms compared to those who experience early peak. And also from this graph, you can see that the coefficient can be either negative or not significant or zero. And to clarify that possibility, we show some examples of states of how the distribution of those variables look like. And so you can see that, for example, for Texas, when avoiding contact goes up over time, community sea lice goes down. That's why the association is negative. While for Minnesota, we do not observe such association, so the effect is not significant. We also build a model using deaths, hospitalizations, and community sea lice by age groups. There are several important takeaways from this graph. However, the most important one, I think, is that community sea lice for younger age group positively affects community sea lice for older age group, which in turn increases the new deaths from coronavirus. So that means that older people are infected by younger people, and using that model and all those variables in a single model, we can explain changes in the variable about new deaths from coronavirus. So let us proceed to the analysis by countries. Here again, we used a very similar set of variables, community sea lice. However, we also used another behavior-related characteristics, wearing a mask and attending public events, and again, stringency index. Again, we build a model for all our countries, and here you can see that stringency index, wearing a mask and attendance of public events do not significantly affect community sea lice. So they do not work as mechanisms mitigating coronavirus spread. However, this is a very average picture. So we can, for instance, split our analysis by age groups. Here again, stringency index in both age groups does not affect community sea lice significantly. However, wearing a mask for older age group actually reduces community sea lice, while for younger age group, it increases community sea lice through increasing the attendance of public events. So here we see green arrows. That may mean that younger people may acquire a false sense of security when they wear a mask in public, and they start to attend public events more, and that leads to the growth in the community sea lice, so in the spread of coronavirus. Again, we can visualize our random effects. Here we show the effect of stringency index on community sea lice and of wearing a mask on community sea lice. Again, the effects can be either negative or positive, and to clarify that, we show some examples. For example, for instance, we can interpret the case for Sweden. So for Sweden, we have a positive coefficient of stringency on community sea lice, and we can observe that from here. So when stringency index goes down, community sea lice also goes down. That's why the coefficient is positive, and the effect of wearing a mask on community sea lice is negative. So when wearing a mask goes up, community sea lice goes down. That's why the coefficient is negative. And substantively for Sweden, that may mean that when policy regulations are on the low level, people start to wear masks more voluntarily, and compensating for the absence of harsh government measures, which over time actually reduces the spread of coronavirus. So they do that effectively. So let us sum up our main findings. In our research, we try to show that policy interventions and social distancing behavior work differently for older and younger people, and policy leaders have to account for that when they design their measures. We also try to show that states in the US which experienced a later peak in community sea lice happen to be more effective in terms of reducing coronavirus spread through following social distancing norms, which is interesting. And we also show that the case of countries with less stringent governmental actions like Sweden, may imply that people can be committed to mitigating the pandemic, and that they will voluntarily attempt to prevent the infection proliferation. And in general, we show that using such data, which is highly granular by time, age, and geography, and it contains a behavior-related characteristics which are really useful. So in general, that can be informative for the evaluation of the coronavirus policy issues. So that's it. Thank you very much for your attention.
Thank you. And I just want to share with everyone the incredible amount of work that the team did in response to the judges' questions and queries. And so really, really impressive work. Maybe we can, I think, did we lose the Q&A? Katerina, you can come back on. There you are.
Okay.
Chrissy, any questions for Q&A?
So what are your next steps? Where do you go from here?
You mean what can we do in terms of
Yes,
continuing? Yeah. Well, actually, we can do a lot of things, and the most important ones, I think, refer to a more detailed analysis by countries or regions. So we can investigate that, and we can also use a lot of interesting variables that refer to mental health of people. So psychological characteristics, which is again very important for, I think, policy leaders when they design their governmental measures. Yeah, so that can be
Do you know
interesting.
what you're going to do with the? Do you know what you're going to do with the $25,000?
Oh,
we didn't think about it yet.
Yeah, we didn't think about. We didn't expect to become prize winners. Seriously speaking.
Congratulations.
Thank you.
Thank you.